He's had a history of repeating medical misinformation and scrutinizing long-standing vaccines, sparking an anti-vaccine movement. But President Trump still nominated Robert F. Kennedy Jr. to be the U.S. Health and Human Services Director. Republican senators expressed concerns about Kennedy, but when it came to the confirmation vote, all but one Republican voted with their party to approve his nomination. Many members of the medical community have since raised the red flag about him and his recent claims that antidepressants and vaccines are to blame for chronic illnesses.
So to help us unpack all of this and speak to the facts, as we need to do, is our 9 News medical expert, Dr. Pyle Coley. So thank you so much for being here. Let's talk about antidepressants. Let's go straight there, because he said as addictive as heroin and they cause chronic disease. I mean, he kind of like unleashed on these and they help millions of people every year. So I'm curious your stance on his comments.
I mean, where do I start to unpack this? This is the epitome of medical misinformation, not rooted in science. And that's what has me really worried, because heroin is by definition addictive to every single person that takes it. Antidepressants, on the other hand, are not thought to be addictive. They do create a phenomena called dependence, where the body kind of gets used to them. And so if you stop them abruptly, you can have withdrawal symptoms. But that's not to say that you have a psychological dependence or that you can't wean them off safely. And as you said, Alex, like there have been study after study that showed decrease in suicidal ideations. These are saving lives and helping people cope with depression, which can be such a devastating chronic illness.
And how can comments like that worsen the stigma that clearly already exists when we do talk about mental health or mental health issues? Are you concerned about that as well?
Very concerned, because as a physician, sometimes I'm knocking on that door, the patient doesn't open it. So if you're a patient who's depressed, you already have a mind that creates cognitive distortions. On top of that, you layer these scientific distortions. You're going to be very reluctant to reach for something that you think might be addictive or you might not be able to get off of. And similarly, for the rest of society, you find out your colleague or your coworker or your friend or your spouse or anyone else is on an antidepressant, you start to worry that they're getting on something addictive. So it's actually, creating a barrier for people to seek this treatment, which is really helpful.
I'm sure there's a lot of fear out there for folks who take these drugs. They are helping them, function throughout life. What's going to happen in the next months or years? Just any advice? What do you think?
Yeah, I'm worried about a couple things. One is that people see this and abruptly stop their antidepressants. And then not only can that precipitate withdrawal, it can rebound your depression, right? If you stop it too quickly without safety. But the second really being sort of what we've been discussing, which is that people are too afraid to reach for them. And the whole idea of talking about mental health, normalizing it, addressing it, treating it, diagnosing it, starts to take a back seat because people worry that they're going to be judged or that there's no effective treatments out there. So they start to minimize their symptoms, which can create a mental health spiral.
That's alarming. As someone who's reliant on her antidepressants, I just want to say you're not alone. And that is very terrifying, because I wouldn't be here without my antidepressants.
And I'm sure you would realize this is a chronic illness that waxes and wanes. You can come on and off your antidepressant as you need to. For some people, they need it all the time, but it's so helpful.
It is. And I've tried everything from diet and exercise and positivity, podcasts. So I just want people to know, because I often, if I bring it up, people say to me, well, why don't you try X, Y, and Z? I'm the type of person that does everything first and then reaches for a prescription. So I just wanted to state that. But, just having a well-rounded discussion here, are there any policies that you do agree with that RFK Jr. has suggested?
There are, actually. I'm really excited about his stance on taking on ultra-processed food and the dyes and the food additives. And I cannot wait for somebody to come into power that actually says, okay, FDA, nutrition is a big part of your arm. You're the Food and Drug Administration. There's been too much focus just on the drug piece. We really do need to start turning to our foods and getting rid of, cereals that are processed and making sure our kids have healthy lunches. So I am excited about that, but I want to caution again, because there's some things that are based in misinformation, like raw milk being healthy for you, which can cause bacterial contamination, fluoride, being dangerous, and, many other things out there that are sort of mixed into this war on food that we have to be careful about, making sure we sort out fact from fiction.
Yeah, we were just told 30 seconds in our ear, but I think we have to touch upon vaccines, because that's been such, a prominent thing that he's discussed. And in Colorado, we've already seen from COVID, those numbers decrease every year. So can you just talk about how important they are really quickly, especially for our kids?
The vaccine mistrust that this administration is sowing, it terrifies me, because we're going to bring back diseases that have been eradicated. We're going to bring back pandemics after pandemics. And, as you said, we've already seen an attrition happen. And the links about vaccine and autism misinformation, not based in science. Any pediatrician will tell you that.
Dr. Coley, thank you for your insight. I know. Thank you.